Thumb sucking is considered absolute normal until 1 year of age. No televisions or no mobile phones while eating the food. Strictly no pacifiers after 6 months of age. Avoid a refined and starchy diet. Initial few days you take 75% of milk with 25% of water. After 3-4 days, 50% milk and 50% of water. And after a couple of days, reverse the order, that is 75% of water and 25% of milk. So you're basically diluted the milk to such an extent that the child refuses to have the milk in the sleep.
Hello and welcome to another episode of the Modern Indian Parent Podcast, the podcast that is redefining parenting in Indian families. I am Rini Gupta, I'm a pediatric sleep consultant, and every week we bring you episodes that allow you to own your modern parenting choices, even if Nani and Dadi don't agree with them. Today we have a very special guest with us, Dr. Vivek Jogani. He's a pediatric dentist from Mumbai who specializes in preventive care. In the last 15 years, he has treated thousands of kids to give them their beautiful smiles, and he's loved by the children as well as their parents. Hello. So this is part 2 of the episode that was recorded with Dr. Vivek Jogani. In this episode, we will be discussing specific dental concerns such as the use of baby bottles and how it leads to dental caries, use of pacifiers, thumb sucking and how to get out of these habits. If you're looking for more generic information about taking care of your child's teeth, such as which toothbrush to use, which toothpaste to use, how to brush your child's teeth, how often to do it, and what are the other things that you need to do to take care of your children's teeth on a day-to-day basis, check out part 1 of this episode, which is just filled with practical tips from Dr. Jogani. I'm going to link it right up here. But of course, if you want specific information about pacifiers, thumb sucking, baby bottles, and how to wean them, stick around for part 2. I'm a sleep consultant. So one thing that I always see parents do is that they'll do the bedtime routine and then they feed milk to put the baby to sleep. I typically work with babies after 6 months, but I've seen this happen all the way till 3 years of age as well.
Yeah. So after a certain age, you need to start weaning the child from nocturnal feeding, basically. So when we talk about first 6 months, definitely you can just keep this gauze wipes or muslin cloth by your bedside, and as and when possible, you can clean it. So as much as you clean, it's not that after every feed, if possible after every feed, if not then after 2-3 feeds. Yeah, see to it that when the child is sleeping, you can just put in the wet muslin cloth and just wipe it along, and that should take care of it. Now when you ask me that kids, they go off to sleep and in the night a 2.5 year old child being given a bottle feed, that's where nursing pattern of decay comes into picture. This we call it either nursing pattern of decay or baby bottle syndrome. So baby bottle syndrome is quite common. Today we are seeing almost 7 to 8 kids out of 10 kids having decay. So the usual technique that we usually ask parents to do is lift the lip and check. So every young mother has to all do is when the child is sleeping, just reflect the lip and see this upper front 6 teeth, and if you see any white spot lesions, they're going to be chalky white areas on the tooth surface, or there is some plaque accumulated, then it means that the child is showing signs of early childhood caries. And that's where you have to visit your pediatric dentist, considering it as an emergency.
And then what about like night feeds? How early do you start seeing these kind of caries happening? Because I think, let's say a 2.5, I think that's quite late. But typically parents are like holding on to a few night feeds at least until the kid is like 1 year, 18 months old. Would you recommend weaning away night feeds for better dental care?
Weaning can start happening at least 15 to 18 months of age. Mm-hmm. So you can start weaning the child, and if yet you prefer nursing the child more, yes, you can nurse the child all through the day, but wean the child from night feeding. So 15 to 18 months is the right age to teach the child not to have anything in the when you ask me what is the number of kids I would see with nursing bottle of decay at 18 months, well, at 18 months, we see as much as 70% of the kids today having some kind of dental problem, dental decays, or the white spot lesions. They may not require an emergency dental treatment protocol, but you have to work on a preventive aspect from that point in time. If some parents are not aware of this lift the lip technique and observe, and they realize that there is a boil in the upper gum just below the lip, or sometimes the child stops eating, and then when they come and they are surprised when we say that this tooth has gone beyond repair and it's a root canal or extraction. So here what is important is to understand the fact that not all dental problems are dictated by pain, swelling, or infection. They can be silent as well. And parents are quite surprised that my child never complained of pain, and how is that possible? That's because this kind of nursing pattern of decays gets prolonged over a long period of time, and it causes problems.
So this is regarding night feeds. So you're saying that by 15 to 18 months max, you should be stopping night feeds, so that to
Yes.
protect the teeth. What about feeding to sleep, let's say for nap time? The reason I'm asking about sleep questions, like I said, I'm a sleep consultant, and one thing that I'm actively advising parents not to do, I actually just did a toddler sleep episode, and I told them one of the biggest mistakes they are making for their toddler sleep, which is a child over 1, is that they are bottle feeding to sleep. I work with families where the child lies down, they give them the bottle, the child drinks, and just like falls asleep, and then the parent comes in and gets the bottle out of the bed, and that's how they put the child to bed. And I think that's a really wrong thing to do. And what is your opinion on that?
So here we can help them by giving few recommendations. When you start weaning the child, you may not wean the child completely in a day or two. It takes time. You can take your time of 2 weeks, 3 weeks, plan it out. So the initial few days, you take 75% of milk with 25% of water. That is diluted. After 3-4 days, you dilute it equal proportion, that is 50% milk and 50% of water. Definitely there has to be no added sugar to it. And then again after a couple of days you reverse the order, that is 75% of water and 25% of milk. So you've basically diluted the milk to such an extent that the child refuses to have the milk in the sleep.
I understand. But like, it's like the bottle itself is something that they don't want anymore.
Yes. And then, this is a major task with nuclear families. How do I wean my child so soon? So, one is you start diluting the milk content so that it does not pool around the oral cavity. Second is after every feed, give sips of water, or again with a muslin cloth. Even if it's a 3-year-old baby, you can just definitely wipe off the labial surfaces of the teeth. And more importantly, kids understand when you explain them and you teach them in the way they want to learn. So what we usually recommend is just with a marker, just the undersurface of the bottle, just put some black scratch marks and show them that the bottle has got dirty and it's not getting clean anymore. Can we just discard it? And the child really agrees to. You throw the bottle in front of the child so he knows that it is gone, then they don't put in tantrums behind it. That's how you make the child participant to the entire scene rather than you taking the decision and putting it on the child that no, you're not supposed to. When you do that, kids start getting irritable. They want to have their choice, they want to make decisions. So if you make participant to this, make them understand that it has gone black because of the black marker, which they don't know why it has happened, and you have thrown the bottle right in front of them, they will accept it better than you doing it behind them.
Of course, they will internalize it, like, because the changes happen in front of them, and that is a great strategy, I would say, to just get rid of the bottle altogether, which I think is a very tough move for so many parents because they're so afraid of how their child is going to react. They're not going to drink enough milk, what the tantrums are going to be like. And this is a great strategy that make your child a part of this instead of saying no more bottles out of the blue.
One simple trick that just struck me right away is you can coat the nipples of the bottle with asafoetida.
Oh, hing.
It definitely, the first kick, even if it goes into the stomach, it's going to help him in digestion, and the second kick he will never.
I hope. I think like with kids nowadays, they're getting so smart. Like, I'm pretty sure if I did that with my kid, she would just go inside the basin and wash it. She's like, something seems off over here. I'm just
So
gonna
this
wash
has to be
this.
taken in grades. This has to be taken in grades. When you first make them participant to it, there are kids who are extreme, strong-headed. So you have to show them that it has gone black, the nipple has got some different taste, and that's how you can do it.
Of course, of course. This is something that I recommend as well. Because you mentioned the idea of tooth fairy, right? So I always tell the parents that I work with, use a bottle fairy. And I say, you know what, just get your child to put all the bottles in a box and say, today when I go to work, I'm going to go to Bottle Fairy and pay her a visit. And I'm going to give her all your bottles so that she can give it to younger babies. And then you come back with like a new cup or a new bottle, like a straw cup or like a sipper bottle in that box and say, look what a bottle fairy brought for you. And this is for you, my darling, because you're so grown up now. The parents that I work with, they have tried it with their toddlers. Works like a charm, and the child is just like...
It does. It's a positive reinforcement. You reward the child rather than bribing the child. So what you're doing is reward system. After it is taken away, you give some reward. Doing the other way around, it does not work. Kids are smart these days.
Can we talk more about the shaping of the teeth? So let's first talk about pacifiers. As a pediatric dentist, what's your relationship with pacifiers?
Pacifiers, definitely, if used by nuclear families, you want the child to be engaged or sleep well, accepted till 6 months of age. Strictly no pacifiers after 6 months of age. There are customs, or I have come across patients who use pacifiers dipped in honey. It is a strict no. You don't know what level that honey can cause, damage not only to the teeth, but also at times they can introduce some allergens into the body. No, there is no pacifier or bottle nipple that will mimic the mother's breast nipples. So it does hamper the growth and development of the jawbone. So any child who is going to be using pacifier more than a required age, let's say maximum of 12 months of age, then the child is going to get hooked to the pacifier. It will be very difficult for you to wean off the child from pacifiers. So if you have used pacifiers, maybe maximum for 6 months to a year, but beyond that, it will be very difficult to wean. And if you really want to wean, then that is the right age to wean the child, failing which it hampers the upper jaw palate. So it's as simple as introducing a thumb for a thumb sucking habit, which deepens the palate, or a pacifier which is not physiologic in size and shape for the child, and then the palate development gets affected. The child may have problems like malaligned teeth, crooked teeth, severely proclined teeth forwardly placed, which have high tendency of trauma. Even a slight fall or hit with a ball or something, it really injures their teeth and the jaw bones. And these kids also have a high tendency of getting into mouth breathing, tongue thrusting habit, and which overall hampers the growth and development of the child's face.
Something parents should always note for is, if you want to use a pacifier, that's okay, but don't do it beyond 6 months, and definitely not beyond a year, because that is when the issues start coming in, right? But Dr. Jogani, I come across parents fearing introducing a pacifier even to a newborn. And a pacifier is a great tool, especially when you don't know what to do when your child is colicky and you're like, oh my God, the baby's going to bring the house down. It is also known to reduce the risk of SIDS in the first 6 months, right? So, so even when I tell parents that, they always say that like, nahi, daant kharab ho jayenge. The teeth are going to go haywire. But then I'm just like, but your baby doesn't have any teeth right now. So what's your opinion on that? Would introducing a pacifier, even in the newborn phase, have long-term impact on the child's teeth?
Not really. Definitely, if you have weaned off and if you have stopped the pacifier at the right age, I don't think there's any implication.
That's really good to know. I think there'll be a big sigh of relief for a lot of parents, because so many of them continue to struggle, but because their family members are telling them, pacifier nahi hona chahiye, that's going to spoil your child's teeth for a lifetime. And then they struggle during the newborn period, but they don't have to.
So at times we have parents who really don't want to introduce pacifiers for a simple reason that they don't want it to get into a habit of.
Correct. Absolutely. Because they're like, why introduce something which you then have to wean? So that's definitely a thought process behind it. You mentioned about thumb sucking, which is also something that I see a lot with the parents that I work with, because they are like, my child is now sucking his thumb to sleep. what do I do? It's a big problem. I don't want this. So what's your opinion about thumb sucking behavior as a pediatric dentist?
That's my favorite topic.
Let's talk about
Yeah.
it.
So, well, thumb sucking is important for a child. It gives them instant gratification. It gives them the comfort. They sleep well. So, thumb sucking is considered absolute normal until 1 year of age, maximum 2 years of age. By 18 months to 2 years, you have to start working on, weaning the child from thumb sucking as well. There are kids who have habit of using, blanket corner in the mouth or the thumb, or sometimes some kids want two fingers into the mouth. So any kind of sucking until the child is in the oral phase of its psychological development is considered normal. Beyond that, it takes an abnormal shape. So 2 years is the max from my end that the child is permitted to have thumb sucking habit, post which you have to stop thumb sucking by way of reminder therapy or any home remedy, or you can take help from your pediatric dentist, because the help with what your pediatric dentist is going to offer you is going to wean the child from thumb sucking 100%. There are tips and tricks wherein coating the thumb with asafoetida or some different flavored thing which the child does not like. I usually don't prefer kids using something like the chemicals that are available at the chemist. You can use a lot of home care methods. Then putting the child on long sleeve shirts while sleeping at night, wherein their hands are locked in the sleeves, so it gets difficult for them to remove it and then do the thumb sucking. This is one easy trick which most of the parents do it, and the kids come out of thumb sucking very easily. If the reminder therapy does not work, definitely you have to visit a pediatric dentist, the one who's going to fix something into the oral cavity and take care of it. Failing which, again, like we just discussed, the teeth getting forwardly placed, you start seeing the tongue at night while sleeping, the child starting to breathe through the mouth at night, becoming a mouth breather, and then they don't sleep well.
Dr. Jogani, you mentioned about not using chemicals to get rid of the thumb sucking habit. Do you know there are these like pediatric nail paints available,
Yes.
which are like clear nail paints, and they taste kind of off for babies, just to kind of not do that. What's your thought about those nail paints?
I would work on home remedies like maybe asafoetida, chili powder, pepper, black pepper. You're not coating it completely, it's just the water soaked, and don't make the child aware when you're coating it. So it just has to be like you've taken it, rubbed it. If you make the child aware that you're doing something, he's going to go and wash it. So the kick has to come without him knowing that how did it smell or how did it taste that way. You can even use garlic water, you can use onion water. There are so many options available in the kitchen. Honestly,
I'm a little worried. What if the kid like gets it in their eye? Like that would be my biggest worry, because instead of doing this, they end up doing this or like this, and then that's it. It would like burn, like cause like a burning sensation in the eye.
Yeah, so asafoetida is quite safe. Obviously, when you have done something like this, you are within the reach of the child. You are not in the other room. You are observing what the child is doing. And you have to observe that so that you know what should be your next step.
And there are also these like I've seen these thumb caps available, like something that like goes over their thumb.
Thumb sleeves, thumb cap. But yeah, so if you see a 4-year-old, 5-year-old, it's easy for them to remove it.
True. So if you're trying to get rid of it as early as, let's say, an 18-month-old baby or a 2 years old, then you can still use those.
Good. 2 years is
2 years is good.
Yes.
Yeah, and you can use a thumb cap. And can the children wear the thumb cap overnight as well? Like, is that safe?
Yes, why not? I would rather put the child in long sleeve t-shirts or long sleeve shirts wherein their hands are put totally, and you can just tie the ends after the child has slept.
Got it. Thumb sucking, it's a way of emotional regulation and soothing, right?
Absolutely.
So, I tell parents that you have to not only look at like how do you stop it, but how do you replace that soothing? If your child is getting triggered by they're anxious around new people, or they just got scolded, or something didn't go their way, and then they start like anxiously sucking their thumb to soothe themselves, why don't you offer them something else? You be their source of comfort during that time so that they don't have to resort to thumb sucking. So work on the trigger. As a sleep consultant, one of the things they always like, my baby sucks his thumb to sleep, or my toddler is sucking his thumb to sleep. What do I do? I said, at the end of the day, the thumb is a source of comfort. Why don't we provide maybe a stuffed toy or provide like mommy's t-shirt that smells like mommy and get that child to hug that instead? Provide alternative sources of comfort so that the size of the thumb goes down. And if you had to make a comparison between pacifier and thumb sucking, and I'll give you an example. Parents will come to me and say, maybe they have a 4-month-old, and say, my child is sucking his thumb to sleep. Should I introduce a pacifier instead? Because pacifier later I can take away, but how will I take away the thumb? As a doctor, which one would you recommend?
You have to understand that there are two types of sucking. One is nutritive sucking and the other is non-nutritive sucking. So nutritive sucking is nursing or bottle feeding the baby. Non-nutritive sucking is either thumb sucking or a pacifier. If I've introduced a pacifier, I can take away the pacifier. It does not mean that the child will not get into the thumb sucking later.
Of course, yes. Yes.
If you are introducing a pacifier, the chances of child going into thumb sucking is high. If the child is on thumb sucking, it will be easy for you to wean off the child from thumb sucking. Rather, wean the child from pacifier
First.
And then the child gets an easy access to the thumb. Thumb is going to exist then as well.
I get it. I always figured that because the shape and everything else is very different. Because I think for my own daughter, like we used a pacifier till she was 7 months old. And then we weaned it along with sleep training. She never really found her way to her thumb. She just kind of let it be. But of course, I can't use one example to justify or to be able to explain everything else. I think you have a much better perspective on this. So you're saying that if a parent has to make a choice between a pacifier and thumb sucking, as a form of non-nutritive sucking, they might as well just stick with the thumb sucking. There is no need to introduce a pacifier.
Yeah, because thumb sucking the child will be doing by himself. Pacifier is something which you are introducing. So not all kids who are going to take thumb are going to take thumb for a year. They may take it for a month, they may take it for a week, depending on how the parent has comforted the child.
All right. Yes, that makes so much sense. And there's, like I mentioned, I think I'm just getting so many golden nuggets out of this conversation. Now, if I were to ask you for 5 commandments for the best dental care for your child, what would they be?
So the 5 commands that I would like to give for all the parents is avoid a refined and a starchy diet. Have a healthy diet and healthy snacks including veggies and salads, fresh fruit. Brushing twice a day and night brushing is an absolute compulsion. No gadgets, no televisions or no mobile phones while eating the food, and visit your pediatric dentist every 6 months.
Amazing. Thank you so much. I think we are all going to be sure to follow this because we want our children to have the best possible little smiles that they have. And thank you for making it possible for so many families over the last 15 years.
Thank you so much.